Today our topic is Down syndrome, trisomy 21. Down syndrome, this is the most common chromosome abnormality in human. It is typically associated with a delay in cognitive ability, that is mental retardation and physical growth, and a particular set of facial characteristics. The average IQ of the young adult with Down syndrome is around 50, compared to children without the condition with an IQ of 100. A large proportion of the individuals with the Down syndrome have a severe degree of intellectual disability. Defect is there is a numerical chromosome abnormality caused by the presence of the third copy of the chromosome 21, extra chromosome 21. The extra chromosome causes a problem with the way of body and the brain develop. There will be incidence of nearly 1:700. The genetic types are non-distinction. During the metameiosis, they are resulting in the ovum with a 24 chromosome, 2 chromosome 21 instead of 1. IQ is low and its mother age is dependent 1. In case of translocation, there will be 4%. The extra chromosome is translocated to another acrocentric chromosome. IQ is low and it is not the mother age dependent. One of the parents should be translocation carrier. Mosaicism, the post-fertilization event, here the IQ will be better. Recurrence risk in the non-disjunction is it depends upon the mother's age. The risk increases with the advanced maternal age. In case of translocation, dependent on the chromosome to which the extra 21 is located, to D group, 1/3 down, 1/3 normal, 1/3 will be the carrier. So, to the chromosome 21, there will be the 100% of the Down syndrome. In case of mosaicism, there will be a minimal one. Clinical picture. Down syndrome symptoms vary from the person to person and can range from mild to severe. However, children with the Down syndrome have the widely recognized appearance, delayed mental and the social development, social smile, mother recognition, speech delay. Most individuals with the Down syndrome have the intellectual disability in the mild IQ 50 to 70 to moderate IQ 35 to 50 range, impulsive behavior, poor judgment, short attention span, slow learning. In some cases, the children or adults with the Down syndrome are at the increased risk for developing the epilepsy and also the Alzheimer's disease. Delayed motor development. There will be the head support, sitting, crawling, walking. Fine motor skills are delayed. Some children will begin the walking at around 2 years of age, while others will not walk until the age 4. The development of the gross motor skills, the affection is quite variable. The characteristics dysmorphic features in the head and neck. While speaking about the skull, there will be the brachycephaly, delayed closure of the AF, anterior fornicle, microcephaly, separated joints between the bones of skull. There will be the sutures, which is separated. In case of hair, which is silky, in eye, there will be the upward slanting palpebral feature, medial epicanthal fold, and the speckled iris, that is brush-filled iris. In case of nose, there will be depressed nasal bridge and the flattened nose. Ears, small ears, malformed, overfolded helix, and the underdeveloped ear lobule. Mouth. The mouth is nearly small mouth, small oral cavity, and the protected of the fissured tongue. Neck, it is short and broad, and the excess skin at the nape of skin. While speaking about the hands, feet, and the abdomen, hand, this is short on the broad hands, clendactyly, incurved little finger, Simon crease, the single transverse palmar crease. While speaking about the feet, this is the short and the broad feet. The wide gap between the first and the second is sandal gap. While speaking about the abdomen, this is the distension and the hernia. Associated congenital anomalies, cardiac and atrioventricular septal defect is also known as the endocardial cushion defect. This is the most common form with up to 40% of patients were affected. This is closely followed by the ventricular septal defect that affects approximately 35% of patients. GIT, duodenal atresia, annular pancreas, imperforate anus, gastroesophageal reflux disease, and the celiac disease. They are also more common among the people with DS. While speaking about the renal anomalies, There will be congestal enlarged colon, umbilical hernia, abnormal pelvis. Complications like cardiac, there will be heart failure, increased risk of leukemia, in particular the acute lymphoblastic leukemia, at least 10 times more common in the Down syndrome, and the megakaryoblast form of acute myelogenous leukemia is at least 50 times more common in the DS. Thyroid disorder. Low thyroid is more common, occurring in almost a third of those with DS. This can be due to the absence of the thyroid at birth, congenital hypothyroidism, or due to the lack on the thyroid by the immune system. Eye disorder. Almost half have the strabismus, refractive errors, cataracts, keratoconus, and the glaucoma. Hip problems, like they have the risk of dislocation. Sleep apnea, because of the mouth, throat, and the airway, they are narrowed. Hearing problems, they are probably caused by the regular ear infection. Diagnosis. The Down syndrome can be identified in the baby at birth or even before the birth by the prenatal screening. A doctor can make the initial diagnosis of the Down syndrome at birth based on how the baby looks. The doctor may hear the heart murmur when listening to the baby chest with a stethoscope. Under the lab, they can go for CBC, karyotyping. This should be done in every patient to determine the type and the recurrence risk. Imaging. Echocardiogram to check for the heart defect, usually done soon after the birth. ECG, X-ray of the chest and the gastrointestinal tract and the abdominal USA. GIT and the renal abnormalities. Antenatal diagnosis. Indications like old maternal age, which is greater than 35, previous baby with the DS, and the family history of a translocation. Triple test done in the maternal serum at 15th to 16th week of gestation. There should be the low alpha fetoprotein, low unconjugated estriol, and increased beta human chronic gonadotrophin. Other serum marker for the Down syndrome will be pregnancy associated plasma protein levels, which is reduced, and inhibin A, which are raised levels. Fetal karyotyping, amniocentesis 14 to 16th week of gestation, chronic villus sample 9 to 12 weeks of gestation. Fetal US, the nuptial translucency ultrasound, thickening of the nuptial fold at the back of the neck due to the delayed drainage of the fluid from the upper part of the body. Short femur, cystic hygroma of the neck, and the duodenal stenosis. Treatment. There is no specific treatment for Down syndrome. A child born with a gastrointestinal blockage may need major surgery immediately after the birth. Certain heart defects may also require the surgery. When breastfeeding, the baby should be well supported and fully awake. The baby may have some leakage before of the port uncontrolled. However, many infants with Down syndrome can successfully breastfeed. Obesity can become the problem for the older children and adults. Getting plenty of activity and avoiding the high calorie food are important. Behavioral training can help the people with the Down syndrome and their families. They deal with the anger and the compulsive behavior that often occur. At the same time, it is important to encourage the independence. Special education and training is offered in most communities for the children with the delays in their mental development. Speech therapy may also improve the language skills. Physical therapy may teach the movement skills. Special educators are also often needed. Person with the Down syndrome is often need to be closely screened for the certain medication. They should have eye exam every year during their infancy, hearing test every 6 to 12 months depending on the age, dental exams every 6 months, X-rays of the upper or the cervical spine between the ages of 3 to 5 years, risk of the subluxation of atlantoaxial joint, thyroid testing every 12 months. Prevention, the genetic counseling for the person with the family history of a Down syndrome. The risk is significantly higher among the women who are the age of 35 and older. The American College of Obstetricians and the Gynecologists recommends offering the Down syndrome screening test to all pregnant women regardless of age. Thank you.